back. Now we will take all your questions on coronavirus. We will be joined on the show by Dr. Vivek Nanga, who is the head of the Department of Pulmonology in Fortis Hospital at Vasant Kunj, Dr. Sameer Gupta, who is a cardiologist, and he is with the Metro Group of Hospitals. And from Mumbai, we will be joined by Dr. Mahira Desai. Well, let's begin the discussion with Dr. Nanga, and we already have our first caller calling us from Chennai, Binu Gupta. Binu, if you can go ahead with your question.
Yeah. So, hi, doctor. My question is, I'm working from my home. I'm working in a IT firm, so I'm working from my home since 2 weeks. So, the problem with me is, last week I started feeling something has got stuck in my throat, like some hair or some thread, something like that. So I was going through some online suggestions, where they said if you can try to figure out by seeing in the mirror, or maybe you can try it out with your pulling with your finger. So I tried all those things, and when it didn't work out, so after around 2 to 3 days, I have gone to the Fortis hospital. So there, ENT doctor was not available, but they checked me in the emergency ward, and they have done all the screening and everything. So today, it's been 5 days. It's 5th day for me. I'm taking my medicine. So I'm feeling the throat pain, and all these things has gone better. I have no temperature. I have no other symptoms like any other thing, whatever severe cough or something like that. So do I need to I need to worry for something,
right,
or do I need to go for any check or something like that? Because I am
right.
already.
Doc, would you answer that question? I think he has understood what you're talking about, Binu.
Yeah, hi Binu. So that's a very good question, and I guess we are inundated by this question very often now. That mild sore throat, mild cough, should we do something or not? It's best to take just home remedies and isolate yourself from the rest of the family. Irrespective of the fact whether this is COVID-19 or even any other flu or virus, I'm sure you would not want to spread it to the rest of the family. So take some symptomatic treatment, home remedies, stay isolated from the rest of the family. If your throat and cough is already better, then I don't think you need to worry. But still, a social distancing is always better to do. Just wear a mask, keep your hands clean, and I guess that should be it.
Right. We are also joined by Dr. Sameer Gupta, cardiologist, with us on the show there. Well, we also have our next caller, Anil Naik from Vizag. Anil, if you have your question, please go ahead with it.
Hi, Rika. This is Anil Naik. And to the doctor, I have a simple question. If we are staying in a small two-bedroom apartment, would it be proper? How would we manage if we are asked to self-quarantine ourselves and there are 3 people in the home?
This is not something which is uncommon in our country. As compared to the Western world, our houses over here are a little bit smaller, and self-quarantine often becomes an issue. But, you have to make the best of what you have. If you are going to self-isolate yourself, try and self-isolate in the room. The person who's sick should always be wearing a mask at all times. Mm-hmm. It would not be a bad idea for everybody else also to wear a mask. Keep good sanitation everywhere. The doorknobs, the floor, all these places, keep it nicely cleaned. Keep the doors and keep the windows open so there's nice, you get fresh air, and the chances of infection spreading is also lesser. So there's some simple common sense things is what you can do. I and Dr. Nanga can also attest to that at work, we as healthcare providers, we are exposed to people all the time. Now, I don't know whether I'm being exposed to COVID positive patients or not, but we use common sense, we have these special clothes. When we come home, we take our shoes outside, we leave them outside, we sanitize ourselves. The clothes we've worn for the day, we wash them every time. You put them in, in detergent, stuff like that. So, if you're self-quarantining yourself, then you can also, the plates, the utensils that people use, clean them up nicely.
Right. We also have our next guest who's from Mumbai, Dr. Mahera Desai, who's also a psychologist. Dr. Desai, let me ask you this question. The government has today said perhaps they are not going to extend the 21-day lockdown period. Do you think that 21 days are enough to isolate and to identify the hotspot and then, decide on how to go forward?
Thank you so much for the question and for having me on the show. Will the 21 days be enough? Possibly not. What have the 21 days given us? Time to scale up facilities, to scale up testing, and to be able to handle the situation better. What else has the 21 days given us? It's given the public awareness that this is a serious crisis. We need to take note now. And as much as the public's vigilance in maintaining the same procedures and the same precautions that the other two doctors have been mentioning will be maintained, that's what's going to protect us.
Right. We have our next caller, R. Kumar, who is from New Delhi. Please go ahead with your question. And Dr. Nangia, if you can take up that question, please.
Sure.
Doctor, all regards to you. I have been seeing the TV, but I am not finding anywhere that generally all hospitals are centrally air conditioned. And you know that air supply is from plenum. It goes back and again it is circulated to all rooms. What is happening to those rooms? Are they really being filtered or disinfected air is being supplied in all rooms? Because I get fear, as an engineer I feel that all rooms will have all wires and all such things. I have not heard on TV so far. Kindly tell me what is happening so that everybody, All India Institute of Medical Sciences, Jang, all hospitals should know. Kindly tell me so that I am having peace of mind. My countrymen, because sometimes it is neglected and sometimes engineers are not taking care that proper, air is filtered and supplied to all rooms, because the common air goes back and it is again supplied. Kindly.
Right, Mr. Kumar.
Yes, please.
So,
Yes,
Mr.
Dr.
Kumar,
Nangia.
thank you for a very good question again. There are two parts to your question. One is that, we know that this infection is mainly spreading by droplets and contact. Whether there is an aerial transmission or not, we don't know. So, unless patient is coughing, being nebulized, is being put on a ventilator or is undergoing a procedure which is called bronchoscopy, there are not as much of aerosol that is being generated that one would fear that it would get transmitted through the air and the AC. Having said that, we are still taking all those precautions. Whenever we have to conduct a procedure like that, we keep the patient in a negative suction room where there is a completely, the air is being exhausted outside and not inside. Second, in every hospital, there are multiple AHUs, the air handling units, which are feeding separate areas. Like in our hospital, we have dedicated a complete floor for these kind of patients, which has a separate air conditioning. So there is no mix of air conditioning between this area and the rest of the hospital. So rest assured, none of the other patients are likely to get affected because of this cohort of patients who are being managed in the hospital.
Right. So our next caller is Maninder from New Delhi. Maninder, go ahead with your question, and Dr. Gupta, if you can take over that question and if you can answer that.
Doctor, so my question is regarding a disease known as sarcoidosis, and what precautions should patients suffering from sarcoidosis take?
So sarcoidosis is a lung disease. For those who don't know about it, it's a lung disease, and we know that patients who have especially who have heart disease and also lung disease, are kind of predisposed, or they can get the most serious version of the COVID-19. However, the precautions that you take remain universal, right? Social distancing, wearing a mask, especially for somebody like yourself who's already kind of predisposed or for having a more severe version of this, washing your hands, sanitizers, and also talking to your doctor and seeing that your sarcoidosis is well controlled. What is the level of ILD? So those are some of the things to consider, but there are no specific guidelines per se as to what to do for each thing. And just to add one more point to my previous panelists' answer, the government has also now come up with guidelines as to how each room has to be sanitized and to how public areas have to be sanitized in the hospital setting. Even there are guidelines for transfer of COVID positive patients from one facility to the other facility. There are guidelines for that. And also the government is now going towards more COVID specific hospitals. So depending upon which geography you live in, it's a kind of a state by state decision whether there should be complete isolation wards in a hospital versus COVID special hospitals. So the COVID quarantine inside the hospital was done in Italy, and they found that it was not very feasible. It was not very good compared to what China and Korea did, where they had COVID special hospitals. Just to add to my previous doctor's answers.
Right. And
to add to Dr. Samir Gupta's answer,
yes,
I would
please.
also like to say for patients who have an underlying lung disease like sarcoidosis, asthma, COPD, ILD, etc., they should get their routine vaccinations done. The influenza shot and the pneumococcal vaccine as well.
Important.
Yeah, so those just add to build up your immunity against these viruses and these bacteria, so that they at least protect you from a secondary infection that may happen.
Right. Our next caller is from Mumbai. Parveen, आपका question क्या है बताइए?
मुझे पूछना था कि एनीमिक पेशेंट के ऊपर इसका क्या इफेक्ट होता है, और माय सन उसकी एक हिस्ट्री है पीछे की, जैसे कि उसको टीबी हुआ था, तो इसके लिए मुझे पूछना था उनके ऊपर कोरोना वायरस का ज्यादा असर होता है?
Dr. Nangia, can you take that question, please?
जी, so basically अगर ट्यूबरकुलोसिस हुआ था तो उनका जो इम्यून सिस्टम है थोड़ा सा वीक रहा है, और अगर कोई स्कार रह गया है लंग्स के अंदर तो उसमें संभावना है री इन्फेक्शन होने की, तो उनको जो है प्रिवेंट करके रखना और भी ज्यादा जरूरी है. अगर एक्टिव टीबी है तो ज्यादा जरूरी है, अगर इनएक्टिव है, पास्ट में से 5 साल पहले 10 साल पहले हुई थी, तो फिर इतना कोई एडेड रिस्क नहीं है. तो अब तक इम्यून सिस्टम उस बीमारी से रिकवर कर गया होगा उनका.
Right. Dr. Desai, while all of us need to do the due diligence to, kind of combat COVID-19, tell us what has been the psychological impact on people and what have you really seen, and what are the top 5 suggestions that you will give people to be able to get over these difficult times?
Sure. So a lot of panic, a lot of fear is seen, which is understandable in a situation like this. It's a crisis we've never seen before. At an individual level, we need to deal with it at 3 levels, further, in fact. One is at an emotional level. You need to get a control in terms of calming yourself down before you receive information.
Right.
Very often in a state of fear and panic, we just accept anything that we receive without checking the credibility of the source from which we are getting it. So that awareness, I think, is very important. Breathing exercises, yoga, simple things can be done. The second thing is to get the right information from reliable sources. I'd encourage everybody to please stop sharing WhatsApp forwards. We have amazing sources with the WHO, with the CDC, the government's providing information. Use that, that's reliable. Third is going to be to actually implement these behaviors. A lot of the younger generation feel, because of the information out there, that they are going to be immune, or so to say, even if they get mild disease, they are going to recover quickly. This is not the time to just look out for yourself. You need to watch out for what's happening to families. We are all probably living, most of us, in a joint family setup. We are interacting with elders. So the precautions are necessary not just to protect yourself, but to protect them as well. And just to add to what the other panelists were saying, in times like this of lockdown, a lot of movement is restricted. There's no proven cure yet. There is no vaccination available. Your immune system is what is going to help you respond to this. So, taking care of yourself in terms of adequate sleep, good hygiene, making sure you get some form of exercise, even if it's within your own house, is going to be essential to sort of combat this. And lastly, a routine. A routine is essential to maintain. That throws a lot of people off. Limit the time that you get to learn more about this illness and try to keep life as normal as you can. That's going to help you a long way.
We have our next caller, Sanjay Kaul from Chandigarh. Sanjay, please go ahead with your question.
Hello. Namaskar, ma'am. The
Namaskar,
only question I wish to get an answer from the esteemed doctors. What precautions a hypertensive patient shall have to take?
Right. Dr. Gupta, if you can take that question.
So hypertension is, so I will just continue to say what we talked about before: social distancing, good hand hygiene, etc. I would just like to add another point over here for hypertension per se, which has been brought up in various circles, including the medical community. So we know that hypertensive people are at a higher risk of having poor outcomes if you're infected with COVID. Hypertension was one of those cohorts. Heart disease was the other cohort, and there are various things for that. But in hypertension per se, there's a question being raised in the medical community about the role of the specific type of medicines called ACE inhibitors in ARB blockers. So ACE inhibitors are very commonly used drugs like telmisartan, ramipril, olmesartan. These are drugs which are probably being taken by many of these viewers. And the question comes up: should we stop these drugs, or should we continue taking these hypertensive drugs? Because there is some thought that whether it increases the risk of infections from COVID-19. And I would like to clarify that at this point of time, there is no data and there is no research to show that that continuing to take these medicines increases your complications with COVID-19. So I would just like to clarify that for all the viewers. And as far as the things are concerned to prevent infections, they just remain common, and they're not anything specific for hypertensive patients.
Right. We will continue that discussion. We'll get more callers into the show. But for now, we'll take a very, very quick break on the show. More on the other side. Welcome back. We are still talking to Dr. Nangia, Dr. Gupta and Dr. Mahira Desai from Mumbai and taking your questions on coronavirus. We have 3 callers right now. Very little time left on the show. We'll get all of their questions in first and then ask the doctors to answer. Krishna Hatote has called in from Aurangabad. Please go ahead with your question.
Okay. Hi, doctor. I want to make it clear, verify for you. Whether the myasthenia gravis patient, particularly neuromuscular disorder patient, what precautions they should take?
Right. Heather is there from Jammu. Heather, can you please ask your question?
Hello. Thanks for the platform, ma'am. I'm 25 years old and I have a history of nephrotic syndrome. Okay, since I was 7 years old. So, sir, I am on medication steroids. Okay. So, does that affect my immunity? And to boost my immunity, what should I do?
Right. And finally, Shaukat Khan from Srinagar, please ask your question.
My question is that when somebody is going out on the road, somebody has already sneezed there or coughing there, and it is good for a person to protect himself from a mosque, and mosque won't affect anything because droplets remains there as per the doctor's statement for 23 hours in the air.
Right.
Is it good to have a mosque at that time, or it's useless?
Right. Dr. Nangia, would you take the first question from Krishna Hatote, who's called in from Aurangabad?
I think I'll take both, the first as well as the second questions, because they're both interrelated.
Right.
Both basically refer to an immune compromising state. That means their immunities are low. They are on immunosuppressant drug. So they're definitely more prone or more vulnerable to catching this infection, as well as to developing more complications related to this.
Right.
However, having said that, the basic measures of prevention continue to remain the same: safe distancing, hand hygiene, and wearing a mask if needed. And the moment they have even any signs of cough, cold, they should report immediately and get themselves treated properly and tested as well. And of course, keep the house clean, well ventilated. Again, Dr. Samir Gupta has been has been saying repeatedly that keep the knobs, the handles, doorknobs, everything very clean and sanitized.
Right. Dr. Gupta, will you take the third question from our caller, Shaukat Khan?
Yeah, so the question was regarding wearing masks when you go out.
Right.
And as of now, the government recommendation and the WHO recommendation is that, the masks have to be worn primarily by people who are sick. If you're caring for somebody who's sick, or if you are a healthcare worker, coming in contact with multiple people, or if you're one of those people who's coming in contact with multiple people, maybe you're working in a shop per se. The data for how long these droplets last in air is actually it's changing, because if you remember, we know about this virus only for 3 months. There's a whole host of research and data which is going on. So as we learn more about it, things will change. But there is one school of thought which says maybe we should wear a mask because the particles hang on for a longer amount of time, but then it's not practical for everyone.
Right.
So I think the mask, as of now, according to the WHO recommendations, should be worn primarily by, as it's coming on your screen, healthy people should avoid wearing masks. They should not hoard masks, leave it for the medical professions. Especially Dr. Nanga is going to be intubating people, he's going to be doing bronchoscopies. He will need that mask. So it's primarily for if you're sick yourself, if you're caring for a sick person, or you're a healthcare provider, or I would even extend that to say that if you're one of those people who's coming in contact with multiple people.
Right. Before we close out the show, Dr. Nangia, I have to ask you a very important question. And I'm asking you because this is something that has been prescribed to a lot of Delhi police officials and doctors, hydrochloroquine. Apparently, this is a drug that has been given 2 doses of this is being given to a lot of them who are directly being in touch with either COVID patients or carriers. What impact can this drug have?
Right. Thank you, Rika, for asking a very, very good question. Basically, there's a lot of debate going on whether hydroxychloroquine really works or does not work. However, I'm sure ICMR must have gone through the most updated literature, and that based on that only they've started recommending it. But it is recommended only and only for healthcare workers or contacts of COVID-19 positive patients.
Right.
It's only in those 2 situations that it has to be used, and in no other situation. It can have severe side effects on the body also, although relatively it is considered to be a safe drug and can be given at a stretch for about 4 or 5 years as well. There's not a problem. Many of the patients who have rheumatoid arthritis or any other kind of an autoimmune disease may just be taking it on their own, but we don't know whether that really provides them a direct protection from this disease or not. One is that.
Right.
And second is that as of now, the recommendation is only in high-risk people and not for others. The other thing that I would want to request, put in an earnest request through your medium, is that please, the viewers should not hoard the N95 masks at home. Right. I'm sure they would never use it. Even if somebody in their family does suffer from this illness, they would only require a surgical mask and nothing more than that.
Right.
So leave the N95 mask for us doctors to be able to treat the patients better, so that I hope the situation never arises that due to lack of N95 masks, their patients could actually not be attended by the medical care.
Right. That's a very, very important appeal coming out from the medical community. Please leave out the N95 masks for them.
And
with that, we come to the end of the show. We've completely run out of time, but hope all your questions have been answered. Thanks for watching.